I am Joe Hage. I have the privilege of leading your medical devices group, which, as of this recording, has 350,000 members worldwide. And one of the reasons we've grown so large is we have friends like LexisNexis sponsoring this webinar. We are featuring Rick and Rebecca today to talk to us about how to use medical claims data to grow your market share and outsmart your competition. I will put myself on mute, and Rick, take it away. Thank you.
All right, thank you, Joe. For those on the call today, my name is Richard Grape. I'm a Director of Market Planning at LexisNexis. I'm over our Claims Analytics Suite. So I have an opportunity to interact with a number of different organizations, both on the provider and life science space, as well as some of our friends over in the payer space, as they use our data and analytics as insights into the different markets and opportunities to grow their organizations and products. My background, I come from 10 years of government experience on the LexisNexis side. Contributory is very near and dear to my heart. I'm a passionate advocate for bringing data together and figuring out what unique insights can impact different processes and businesses across the board. I've led projects like the National Accuracy Clearinghouse, which is a contributory food stamp database. It's currently mandated for expansion as part of the 2018 Farm Bill. And I've had an opportunity to work with the healthcare entities for about 9 years of my career. I'm joined today by Rebecca Hauk, one of our market planning managers, also over the Claims Analytics Suite. Rebecca, would you like to give an introduction?
Yes, sure. Good morning, everyone. And as Rick said, so we work with a lot of different providers and life science organizations in the payer space. And I'm working with Rick within that Claims Analytics Solutions that we have at Lexis. Some of my background that I bring is an experience with Medicaid claims data sets, and in particular some work with the behavioral healthcare fields around performance measurement and monitoring, data collection, visualization, and the overall readiness for those value-based payment arrangements and those types of principles. I also have some direct care experience in some of the addiction health fields. So I'm really a strong advocate for data-driven decision-making, and so bringing parties together to figure out what's the data you need and what questions you need to ask in order to find, to make some decisions for your organization. So we're really excited to be here today, so thank you for having us.
Yeah, thank you for the opportunity, folks. So as Joe mentioned, for our webinar today, we're going to cover a handful of different items. We're going to kick off by talking through the state of the industry, common challenges that are impacting all of us across the board. We're going to give a little bit of background on claims adjudication and different paths for potential sourcing so that you can gain access to relevant information to inform your decision-making. We're going to talk a little bit about how that information can help you gain a comprehensive market view, and really the types of data within that your group may want to focus on as you're looking to really decide where to go next, who to target, how to message, and which entities ultimately can result in a larger market share for your products and services. As Joe mentioned, as a refresher for today, we're really talking about boosting your competitive edge. So the goal of this is to discuss how claims data can help grow your market share, as a tool to help outsmart your competition and really gain transparency into who you would want to target, how, when, where, and why. So to kick off our session today, we're going to talk a little bit about the state of the industry. Specifically, during this block, if you have questions, please feel free, as Joe mentioned, to reach out using the chat feature. But if I can start us off today on the right foot, I'd like to give a little bit of insight into how frequently data changes across the board. And as a data provider and a data aggregator, the one thing that I note is that data changes all the time. Practitioner data is frequently changing. You see changes for addresses, phone numbers, fax, etc. And most of these are just in the normal course of business. So in 1 week, we see pretty significant changes among just some of the core demographic information, resulting ultimately in about 2.5% of practitioners across the board that have some sort of demographic change within a month. 20% of these providers will actually end up moving or changing practices within a year. And what that means for you is you conduct outreach efforts that really locking in on which data has changed and why is quite challenging in some cases, because over an 18-month window, 50% of practitioner data has shifted across the board. Knowing who to call, where they're located, and how to get a hold of them will make outreach and sales efforts either challenging or successful. And having access to the most relevant and up-to-date data is a critical component of making sure your outreach efforts are most effective. The next piece I'd like to take us to is actually knowing just who your providers are isn't enough. This is especially true when we turn our attention to specialties and procedural knowledge, which can often change quickly as providers add to their knowledge toolkits. The result is a constantly moving target. So who saw who, when, and where, what steps were performed, and ultimately which products were used. All of these things are shifting in a fairly short window, ultimately meaning that the information that you need to effectively inform and influence, specifically early on, things like provider preference, to inform your sales effort and make sure that targeting and outreach is most effective, really requires access to data that changes and updates as frequently as those practitioners acquire new knowledge. This leads us, in my mind, to what is kind of the start of our industry trends. And this is hallmarked by what I'd like to think of as a move from volume to value, or the shift towards alternate payment models, or APMs. These are indicative, in many cases, value-based care approach. Level setting, as we all know, about 10 years ago, healthcare insurance was paid on volumes. Over the past decade, we've seen a shift from the number of services to the quality of those interactions within the market, really driving towards increased accountability. Volume-based reimbursements are still commonplace, though they are beginning to trend towards a value-based model. For those on the phone, I'm going to give a little bit of an overview of alternate payment models, because this is an area where I think we all need to be quite mindful given the industry shifts that are occurring. So in the market today, we really see 4 different types of payment models. Category one are what are traditional fee-for-service payments. These typically have no link to quality. They're payments that are not adjusted to account for infrastructure investment, provider reporting on quality of data, or provider performance based on costs or quality metrics. The second category are the fee-for-service payments, and these are linked to quality. Payments that are adjusted based on infrastructure investments to improve care or clinical services, whether providers report data, report on quality of data, or how well providers perform on cost and quality measures. The third category, or category 3 up in that top right, these are alternate payment models, and these are built on a fee-for-service architecture specifically. They provide mechanisms for effective management on sets of procedures, episodes of care, and really the magnitude of different healthcare services that might be provided for individuals. This category is typically tracking costs and performance, as well as providing a way to hold providers financially accountable for any kind of performance or appropriate care measures. The last one, category 4, these are population-based payments, and this is ultimately driving providers to deliver person-centered care. And this, I think, is something that we're starting to see. I hear it often called Cadillac medicine, but these payments hold providers accountable for quality of person-centered goals, and that includes everything from preventative health care, health maintenance, health improvement, acute and chronic care services, all of those things across the board. Now, right now, these alternate payment models account for roughly 35% of payments. But across the industry, this represents 77% of the covered population, or roughly 226 million Americans. This shift, in my mind, really represents the start of what we're going to talk about in a moment, and that is the move to consumerism, or really a patient-centered approach. While fee-for-service continues to represent a high percentage of payments, the fee-for-service decline is already well underway. We saw a 2% decline since last year alone, and industry goals actually have alternate payment models to grow 50% or more within the next 5 years. So I know we're talking a little bit about patient outcomes, costs, and experience, but I'd like to shift towards another industry trend that we see, and that is specifically the shift of cost from really the provider entities and the health plans to ultimately the patients. So over the past few years, we've seen that there has been a firm industry shift towards patient responsibility. Patients are being charged with greater ownership of the financial burden to their healthcare. This has really been hallmarked with a shift from PPO to high deductible plans. I'm sure many of us on this call today have experienced that and maybe on high deductible plans ourselves. For employers, this means that they're experiencing a lowering of cost, while from a patient standpoint, they have an increased monthly insurance payment. And the result is ultimately that patients are paying a lot more out of pocket, and this is changing their buying decisions. If you look to the right, you'll see that in a recent survey from Bloomberg, the percent of Americans who moved to high deductible plans has grown pretty considerably since 2010, and that's only expected to rise over the upcoming years. Another industry trend we want to hit on is price transparency. An increased need for price transparency really accompanies the increase in patient financial responsibility that we just talked about. Earlier this year, we saw execution of a new presidential order that required hospitals to publish prices in order to reflect what people pay for services. This action really is a step beyond that which started with the ACA, which had requirements in place for hospitals to publish standard prices on the internet. This was designed to help increase price transparency and thus ultimately better consumer decision-making so that they could make value or cost-based decisions. While the spirit of these efforts is to make costs more patient accessible, their execution has actually been quite poor. So if you look at some hospital systems, many of them address this need by simply making their charge masters available online. The screenshot you'll see here is actually an example, and I'm picking on one hospital entity, but in looking at their charge master, it was over 456 pages long. It was essentially a data dump of all of the different services and costs that were provided. And this is actually making the cost quite difficult for the consumer to decipher, even if they're very skilled at what procedures and costs they may want to take on. So since these are not easily searchable, often hundreds of pages long, this is an area that we see within the industry still has a lot of room for improvement. But that said, that increased shift in price transparency continues to trickle down from not only political leadership within our country, but also the overarching drive to make sure that those costs are more accessible to the patient. The last piece is really an industry trend that is kind of near and dear to my heart. For those on the phone, I'm a millennial, so I am looking at reviews for everything across the board. And this last one is really, it's the move to consumerism. It's the concept of shopping for one's healthcare. In this last sentiment, it really highlights, in many respects, the need to effectively gain consumer mindshare and keep all of their interactions and associations positive. We're definitely in the age of consumerism. Our industry has a very diverse provider ecosystem. You'll see up in the top right, we've got roughly 8.5 million practitioners out there nationwide. And from this, consumers can really pick when, where, and from whom they're going to receive their services. In many ways, healthcare services are becoming more and more like a shopping mall, with consumers picking and choosing who they want to manage their health and why. And as a result of this, effective patient engagement is a critical next step, not only to gain, but ultimately keep their attention. I'm going to use myself as an example for this. So my wife and I recently had a baby. It's our first, so obviously there's a lot of different life changes ahead of me. But life events like this greatly impact where and in the future my family will likely go to receive their health care. We've seen that when certain insurances or doctors don't require you to go to a specific entity, that entity might miss out on a number of future life-changing events. In the same way, if your product or service isn't covered by that plan or isn't covered by that specific facility, you may miss out on a pretty robust opportunity to engage that patient. Each patient has a pretty significant lifetime value for any sort of ongoing interaction. They put their healthcare value roughly at $1.4 million per organization, and really the positive patient experiences will govern and influence choices for any healthcare service that is provided, and ultimately their referral to others that might be part of their close network. And this kind of takes us full circle for four of the main industry trends that we see impacting each of our med device companies, our hospital and provider systems, and ultimately the pharma industry, which is building products and services for patients. Current industry trends really show that knowledge is key. Knowing the who, the where, the cost, and ultimately the options can help your business and as you're planning for product development, for releases, as you're engaging your sales force for targeting and outreach. But how can you effectively gain this knowledge given the immense number of providers and facilities that you might wish to target? The reality is you need data that can help you understand the value of your product within the industry. And that data needs to look at patients, providers, and payers, and ultimately factor in a number of different measures, including costs or who's reimbursing for it. With this, I'd like to turn it over to Rebecca to talk through a couple different challenges within the life science market as a whole. Rebecca?
Perfect, thank you. So when we're talking about what are those, how do those industry trends really apply in the medical device and DME and life sciences space? Like, what are the specific challenges? So one, we're going to talk about, like, how can you find your niche in the market? You really need to be able to identify that market opportunity for your product, where your competition is focused, and what's your market share, and to know which facilities and physicians are going to benefit from your product. How much can you charge? So what's that formulary impact going to be? So knowing your niche is really important, right? So knowing where your product fits in amongst kind of all the other products out there, and how do you differentiate from your competition? And we know this can be challenging, and that's kind of why we're here to talk about that today around the data. One of the other challenges is also knowing how to target your sales and marketing teams. So, what size sales force are you going to need? What should their territories be? It's important to understand, a healthcare provider's relationship to the healthcare organization, and even more so to start looking into the IDN or the ACO, GPO relationships and knowing where to talk about this. We're going to get into this a little bit later, but, targeting a physician may not always work if that hospital or network has a contract with their competitor. So you'd want to know this before investing your sales force at targeting a certain physician. So there's a lot of variables to keep in mind here. And you want to really focus those sales efforts and resources to get that biggest bang for your buck. You don't want to waste your time. We all know that that's a very costly effort if we're going in the wrong direction. And lastly, we need to be able to identify what those industry thought leaders are and subject matter experts. We know this can be a challenge. So these are the folks that really help promote your product and push your product. So, when you were able to get a thought leader or an expert to be loyal to what your new product, that can have a really huge impact on your bottom line. And you being able to influence their decision-making prior to them making your treatment decisions is key. So ultimately, these are really the big challenges that you're being asked to do more with less. You need to spend your time and money wisely, so you need access to accurate and recent data. So we're here to talk, Rick, you can go next slide, please. So we're here to talk specifically about medical claims data as a way to find answers to address those questions. So where your product fits in, where to target your sales and marketing teams, how to identify those thought leaders. Really, in the context of this changing healthcare landscape, it's more and more imperative to have access to that right data. So what you're seeing on the screen, we're here to talk about claims data. And what does claims data really include? So first, let's talk about healthcare providers. So there's a ton of information about healthcare providers. We're talking about millions of practitioners across the United States, over 1,000 payers. And those millions of practitioners might be tied to an ACO, an IDN, the purchasing organizations, and accountable care organizations. And so you can imagine the hierarchies and complexities here in the data set. You can always understand that there's a vast amount of data, so quote unquote, out there to sift through. Next, we're talking about capture and coverage. So there's billions of annual medical claims. So every time you go to a practitioner, a lab, urgent care, inpatient, wherever you go, there's a minimum of one claim is generated by that visit. So you could have multiple diagnoses on that claim with multiple procedures and ultimately drugs or different procedures being done at that claim. So there's a ton of information to glean, but it can seem a little bit overwhelming if we haven't worked with claims data before and where to start. But you're really talking about a nationwide picture of unique patients in all settings of care. Third is to understand the data sources. So this data can come from, the claims data can come from government agencies, so such as like the CMS, so Medicare and Medicaid data, state data, clearinghouses and switches. And really what that means is to get really a robust view of what's happening, you might need to be able to link multiple data sources together to get the most kind of comprehensive view that you need to make use of that claims data. And then also, lastly, we're talking about really frequency of updates. So we got two points I want to make about updates. One, claims are generated daily, right? So the data sources might update as frequently as that, maybe less frequently, but at the end of the day, every time someone goes to a doctor, they're seeing a claim is generated, it goes to the switch. This is rolling data, right? It's changing regularly. And then there's also the updates to consider around the claims adjudication process. So a claim can be submitted and adjudicated until it's resolved, and it can go through, kind of a series of, rounds before we have, the ultimate payment that's made. So this is particularly important when you're talking about remitted claims. So what is charged or billed upon submission may not be the final charge and bill after the adjudication process, and this is an important distinction. So while data is great and we want to be data driven, we also need to focus and know what questions we need to answer. We need to have that right data set to glean those answers from. But on to the next slide, we're going to talk about the general claims adjudication cycle. Just a brief overview, I won't take too long on this, but that cycle is, let's say we have a patient X, let's say it's me, and I go to visit my specialist. There's a medical visit that occurs. The coding specialist, my provider or my hospital or the office has a coding specialist, and they enter that medical information, the medical visit information, and then there's a process for verification and claim submission, and the claim is submitted. This is the 837 form, which we'll review a couple of the basics in a second, but then we go into the denial and change process. So if there's an error or missing data on that submission, there may be a resubmission of the 837 submission form, and then insurance will validate that claim and then issue the payment, which then generates an 835 claim remittance form. This is kind of an overview of the cycle. Some of the basic information that we'll want to know is what is on a claim. So the submitted claim. So first, just as a disclaimer, this is a really simplification of kind of what the raw claim would look like. So there's a ton of information on there, but what are the big key pieces that you'd want to pull out to inform your decision making when you're looking across claims and you want to aggregate data and make some decisions for your product and your organization? So one would be the diagnosis, the ICD-10 codes that understands the nature of the illness. So there can be, again, more than one on these. So let's say I go in to see a doctor, I have diabetes, and I also have high blood pressure. So now I have two diagnoses on that claim. We can talk about procedures, so the CPT code for services provided to the patient. So this might be checking someone's A1C, or they check my blood pressure, do an eye screening. There could be multiple procedures done, some sort of exam that's done during that visit. And then the drug or the HCPCS code for medications that were administered. So let's say my blood sugar spiked really unexpectedly in an office and I need to administer insulin, or maybe I get a flu shot. There can be multiple kind of drugs that are associated and administered in office that would show up under HCPCS code here. You can get some really basic information about the patient, so age, gender, location, some payer information around the insurance plans, as a government or a commercial, who the healthcare practitioner is that treated me, and then where was the service provided. So those are kind of the highlights that you'd want to grab from a submitted claim. When you go into a remitted claim, similarly, it's going to be this is more of a simplification of what we're doing. And Rick, if you can advance the slide, please. There is some overlap between what you'd want to capture on the submitted and remitted claim. It's not really a one-to-one necessarily, but again, we'll see procedures. For the CPT code, we're not really looking at the diagnosis here, because to make the payment, the insurer is really interested in what did you do. So it's looking at the CPT code. So they did some sort of exam at the visit, the procedure details. So there might be some modifiers here. So modifiers give us extra information about the procedure. So let's say you had to do a hip replacement. Well, done on your left hip or your right hip, or a knee replacement, your left knee, your right knee, that kind of thing. There's allowed amount. So what the appropriate HCPCS codes are for medication administered, the payer, so again, who's the insurance company responsible for that payment, the payee, so who's going to receive that payment, so what's the healthcare provider that will receive that, and then that place of service, so that type of location. Is it, an outpatient, inpatient, ambulatory surgical center, that kind of thing. So with that, I'm going to just turn it back to Rick to kind of get into a little bit more about some of the claims analytics.
Thank you, Rebecca. So as we've seen, as we're looking at submitted and remitted claims, the information that we're capturing can actually provide quite a bit of transparency into where an individual might be going, how many patients that specific provider is seeing, ultimately where those patients might go as referrals and things like that happen. And that brings us to what I like to think of as kind of a comprehensive view that can be obtained using claims analytics. There's really three major parts of information that we find within the industry can effectively help inform targeting, inform product design, inform outreach, and ultimately inform costs. So the first piece of this is what we would call volumes. We're looking at the numbers of interactions that might occur for a provider with patients. Networks is really much more of the referrals of who might be interacting with who and might be deferred to who for and why. And then reimbursements, ultimately, really how much do things cost. So we're going to take a look at each of these in a little bit more detail. You'll see there's a couple of quotes up on the screen. This is based on different companies that we've interacted with that have leveraged claims analytics to drive various parts of their business and outreach and targeting efforts. The first of these is going to be that volumes component. And this really answers and addresses the question, what do they do? As organizations work to provide actionable intelligence to their marketing or sales teams, we often find ourselves at the beginning of this three-step process. And I'm going to think of this as kind of a three-step stool or a three-legged stool, because each of these helps reinforce one another. And in the absence of some of this information, you often find that there are holes that fall into decision-making. The first leg of volumes helps organizations with a firm understanding of the who they do business with, who participates in practice, who's seen within a network, and it's often the how that goes unknown. So how are these providers practicing compared to their peers? How entrenched is your competition with these individuals? And ultimately, your organization has an opportunity to look beyond just your data and data you might have on interactions that are driven by a specific product or service that you brought to market, and expand it to obtain a complete picture of all products and services that might be used by those physicians or facilities. So this type of volume-based information is often used to evaluate things like market share and market size. So what is my opportunity and what is my portion of it? We often see folks are evaluating physician, facility, and patient volumes in order to inform their decisioning. Diagnosis and procedures, sometimes there's within this volume-based world a specific need to identify where someone has been diagnosed, and then suddenly before any kind of procedure is performed, where they're likely being sent for that procedure. And then drugs by indication is another area that's commonly evaluated. Now, different organizations use this information in a multitude of different ways, but volume-based information often informs general market intelligence, sales, segmentation, targeting, messaging. So where those outreach efforts will be most impactful, where they'll be most effective as they're attempting to really get your product into the hands of more practitioners and facilities. We do see that market and sales force sizing is something that is often driven. If there's a large opportunity within one region compared to others, this is an easy opportunity for a swag to occur. You'd have very firm targeted list of who you may want to hire to go after individuals within this region, just based on the volume of individuals that they could have interactions with. And then ultimately, this is all driving towards increased product adoption and preference. And that gives you an idea not only of where these physicians are currently spending their time and which products they're using, but where there's an opportunity for you to increase and really establish more market share as a result of that. Comparing physicians at a regional level, and this is calling out for the example down below, you would likely have some information on them, but you might not know how they rank or compare with one another. You'd likely know that they're leveraging your product in some capacity, but you may not know what the full opportunity that that provider actually represents to your business. Volumes can change this. It can shine a clear light, nice and bright on the how much time that practitioner spend at that medical center performing that procedure, and ultimately what % of those procedures they perform is tied to your specific product, designating market share. So we've got a couple examples that we'd like to walk into tied to volumes. Rebecca, do you want to take this slide?
Yes, perfect. So let's just, for the sake of this case, let's pretend that you're a sales representative for a DME supplier, and the product that you sell is a CPAP machine for sleep apnea, and your mission, should you choose to accept it, would be to increase referrals to the supplier of your preferred supplier, right? So you want to focus on those sleep specialists or those neurologists who refer patients to you, and you want to influence their decisions to refer folks that need a CPAP to your preferred supplier. So by using those claims volumes, you can identify where physicians in your geography are sending patients for CPAP orders to be filled, identify if those orders are going to you or competitor, and target those physicians. So in this slide, we see 3 different specialists. We're going to talk about Dr. Black, Dr. Green, and Dr. Blue in this example. And they refer to DME suppliers as CPAP machines. They see patient X, that person's diagnosed with sleep apnea, they need a CPAP, and they refer to a local supplier. So what we see on the next slide is if we focus, well, what we really want to know is, well, who should we target? So volumes data allows us to look at the volumes that Dr. Black, Dr. Green, and Dr. Blue are performing. So if you're looking at this slide, you're seeing in the middle column, that's Dr. Green. That's Dr. Green is referring to your preferred supplier, Universal Med Supply. What you'll see in the ranks is that Dr. Black is the rank 10, so representing their top 10% of those referrals. With Dr. Black, Dr. Blue is 9, and Dr. Green is 7. So they really just give you information on how many volumes of clients that they are referring to a CPAP machine for the specific code, so the E0601 code. And the 3 of these have a combined total referral number of 156 patients, and you want those referrals, right? You want these referrals to you. So what we really see is that last slide that we'll have on this is that Dr. Green, the specialist referring to your supplier, has referred 23 patients. Dr. Black and Dr. Blue have referred sort of a total of 133 patients. So what we're really looking at is out of those 156, 85% of the referrals from these 3 physicians are going to your competitor. That's obviously not what you want to see. You'd want to be able to target Dr. Black and Dr. Blue. So by using sort of this volumes-based data, you can start to influence that. And what this workload kind of, or the primary facility referrals represents at the bottom here is that Dr. Black refers over 50% of her CPAP referrals to Medical Express, your competitor. So this might be a physician that you really specifically want to target. Just by using volumes data, this really gives you a lot of information to focus your sales force. Rick?
Okay, thank you. I apologize, one of the slides skipped ahead on me. So this brings us actually to the next piece of volumes, and this is really a real-time take on what did they do. Often, folks are in need of, many organizations are in need of looking in a short window of time for time-sensitive sales and outreach, specifically between when diagnosis and treatment occurs. This is far more common in the pharma space, but we do believe there's a wealth of different medical device applications, and it's really focused on where you need to know information quickly in advance of a doctor actually performing a procedure, prescribing a specific type of treatment. I think to myself back to cardiology and pacemakers as an example. If you have a new pacemaker that's been brought to market and you want to make sure that that pacemaker is something that is able to impact the greatest volume of patients, it would be very helpful for you to know when a diagnosis has occurred that's likely to result in a pacemaker needing to be put in place. This is really a real-time take on what did they do, and it's looking for right time, right place type treatment interactions. Now, how would you get alert-based insights? Well, you'd have to have data sources that are updating on a daily basis. This would need to look really across the board and be able to discern where you've got new instances of treatment potentially occurring and diagnosis occurring, that your sales force could quickly be targeted in order to conduct outreach to and ensure that marketing as well as boots on the ground sales are able to interact with the providers that are likely going to be the recipients of patients that are recently alerted. We've got a couple examples of this, and we want to talk about some of the levels to which we would want to touch really on this. But before we do that, I'd like to actually shift this over to the second leg of the stool, what we call networks. And this is really the what did they do component. So as I mentioned before, early alerts, an alert type product gives you an opportunity for quick identification of entities or individuals that might be receiving treatment or in need of treatment within a short window. Well, just knowing the volumes, the providers that are seeing patients tied to specific diagnoses, while it gives you one source of insight, where those patients are likely to go next, or where those patients came from and ultimately where they're going, is something that you need really a certain amount of referral analytics in order to establish. So referral analytics can actually give you quite a bit of transparency into uncovering market influencers. So the folks that seem to constantly be at the forefront of a number of interactions tied to patients, diagnosis, or treatments that are specific and likely to have bearing on your product. We see often provider relationships and referrals, and we want a clear understanding of who's going to whom, from whom, and why. Sometimes these are, and thinking in terms of provider networks, sometimes these are out of networks, and there's often key drivers that direct folks from one entity to another that may or may not have anything to do with the actual hospital system that they might be a part of or plan that they might be a part of. It's often, especially with the move to consumerism, patient choice in terms of where they'd like to go and why. And this gives you, in many ways, insight into the care team that ultimately might influence or treat a specific patient. And while that can be useful, is if you have a product or service that you specifically want adopted by a group of patients, so like profile, then it gives you an idea of the other individuals that might be valuable for outreach so that they have information on your product at their disposal. It's top of mind as they interact with that patient every step of the way. That move to consumerism really gives you, coupled with networks, an opportunity to really have very informed marketing and targeting. This can inform your marketing strategy so that you are targeting specifically the high-value relationships, the high-value entities that are likely going to be decision makers, or at least contributing decision makers for a patient. Ultimately, network-type information can be used not only to identify those high target influencers, but ultimately all the potential outreach that might be conducted as a result of a patient seeing that specific provider. And that outreach can ultimately drive product utilization if you've had a chance to actually pepper and discuss with the other stakeholders the value of your product or service in their patient's treatment. So you'll see up here, there's also some reference that has come out as we've worked with different folks that using network data has really helped them to identify patient target groups, and specifically working with physicians to help gain referrals and access to those patients for specific products or services. So we're going to talk a little bit more about networks in detail, but as you think through this, keep that early alerts type component top of mind. And I note that because most of these network-based outreach couple nicely with some sort of volume-based insights. Not only do you want to target on which providers are seeing the highest volume of patients tied to a specific service, but in order for that patient to ultimately know about your product and ultimately make sure that the treatment plan that is established as a whole is bought in equally by the different folks that might interact with them, you'd want to know which folks are likely to be referred to and which folks are likely to see that patient in some other setting of care. So we're going to talk now through a couple examples. Rebecca?
Yes, perfect. Thank you. So just walk me through this network example. We're going to go through two different examples. So one, we're going to talk about a med device company that produces replacement knees. And let's say you're brand B, your competition is brand A. And with volumes data, you can identify, we've kind of covered this already, the big surgeons who are doing those knee replacements. So we can see on here that Dr. Parks, in the dark blue in the middle there, is a rank 9 orthopedic surgeon who represents a lot of volume. This would be a big surgeon you might want to target with volume data. And you can see that Dr. Parks is using your competitor's knee pretty exclusively. And this is one approach, is to target that physician to influence that knee. But we know that this can be really challenging to do, so it can be hard to flip a surgeon from one product to another for various reasons. One could be product loyalty. Another could be they're part of a system that might contract with a competitor. So we know that we have Dr. Fields that is the bottom here using your brand, so brand B, and he still represents a decent amount of volume, but you want more referrals maybe going to Dr. Fields. If you're having a challenge with using the volumes data to influence Dr. Parks in using brand B for whatever those reasons might be, well, then the question would be, well, who's referring to Dr. Fields? So by using that network data that Rick was just covering, you can see that Dr. Bay is the primary care physician who's referring to both of his surgeons for knee replacement surgeries, and currently 65% of his referrals are going to Dr. Parks, who's using, again, your competitor's knees. So what you could do with this data is to then say, well, instead of necessarily targeting Dr. Parks, I can go work with Dr. Bay and identify, educate him or her and enlighten them about the clinical features and the benefits of your product, influence their referrals to those knee surgeons. And so by understanding where the surgeon is receiving their referral from, you can influence at the point of the referral and not the treatment of surgery. And networks is really great for this type of data. This really can shift that balance of where these products, where the surgeries are performed from brand A to brand B in this case. The next scenario, so that's one way you can kind of use networks. But another way to look at this, so we knew Dr. Parks was a ranked 9 orthopedic surgeon, and instead of just looking at, well, who's referring to Dr. Parks, well, let's understand a little bit more about Dr. Parks and where he performs his surgeries. And so Dr. Parks is performing surgery at 3 separate facilities, and by having access to that network-based insight, you can maybe consider talking to those facilities to influence maybe their contacts. So maybe St. Joseph Hospital at the top was 44% of where Dr. Parks performs his knee replacement surgeries. Maybe that's a system that requires you to use your competitor's knees, but you can then go talk to that system to talk about your knee replacement product. So these are just 2 kind of quick examples of how that network data can be really helpful in focusing your efforts.
Thank you, Rebecca. Those are great examples those are great examples of where you can focus on not only the provider that might be seeing the initial patient and doing the referrals, but where you've got a downstream impact to potentially target those facilities. The next piece in our 3 legs that we'd like to talk through is really the reimbursement-based information. So we've already talked about what did they do, where do they go, but this is really focused on the what did they cost. And this is something that those remitted claims that Rebecca spoke about earlier during our session can really provide a lot of transparency that can inform a number of different areas within your workflow. That's used often for ROI analysis, understanding what the benefit might be, competitive pricing, so learning how your product or service compares with others within the market so that you can make more informed pricing decisions, contracting models, and ultimately which entities specifically are contracted in order to purchase your product or service. These things can be surfaced across all of the different volume-based insights that are provided to help you understand where you can maximize remittance rates across your payers and facilities, where you can inform pricing models or strategies so that you're getting higher value contracts, and ultimately where you can identify opportunities to learn and possibly inform new product development. Reimbursement-based insights provide really strategic planners, marketing, sales with an opportunity to leverage data-driven intelligence, dollar data-driven intelligence specifically, and find opportunities where they might be able to even consider expanding a product into a new geographic region, to a new set of facilities, a new provider, as well as possibly even informing some of the formulary decisions that go into where you price your product and how much reimbursement can be achieved based on the different entities that you contract with. Remittance-based insights also can give you transparency not only for how your product or service might bear depending on the place of service, but also among the different payers that might have contracted. And this can also share some of the competitive information so that you know if it's an inpatient setting or if it's contracted through Aetna, where your product ultimately compares with some of your peers. And that allows for more informed rate negotiation the next time you engage with them as you're bringing your product further to market. We have a couple different examples of reimbursement-based insights that we'd like to go into. Rebecca, you want to take this next one?
Yeah, sure. And I think we can cover this relatively quickly. So as a as a med device company, and let's say you produce MRI machines, and you want to know what to charge maybe for your machine as you're going into the market for market entry, and also identify what's the ROI for your buyer. Knowing how many MRIs the end user will have to conduct with their new purchase before seeing a return on investment is a valuable way to position yourself when you're selling your MRI machine to that supplier. And then having access to that payment detail by payer allows you to better understand that median payment, see that variance, so the high and low payments, and inform your formulary with this data to drive higher contract values, as Rick was just saying. And our next example is really looking at, similarly, if we were looking at oxygen machines to treat folks with COPD. If you're the med device manufacturer and you're going to be selling to DME suppliers, you want to know what others are charging and getting paid for that oxygen concentrator to better understand that competitive landscape, help the manufacturer determine what to charge suppliers. And so with reimbursement data, the manufacturer can use the median payment, for example, to help calculate the ROI for that supplier, to identify what those, what the margin is going to be on each device that they purchase. Similarly, if you're the DME supplier and you might, patients might pay you a monthly rental for that oxygen change, that reimbursement data can help you see what other DME suppliers are being reimbursed, and you want to understand what competitors, again, are being paid. So there's a lot of value in seeing that the variance in the payments and making sure that you're not either outpricing or underselling kind of your products when you go into the market. Rick?
Thanks, Rebecca. And this ultimately brings us kind of full circle. So there's three different areas where you can leverage different types of data resources and claims analytics to inform your decision making. We've covered a bit about the what was done, or what did they do, where did they go, what did they cost, and this is something that access to comprehensive claims data can use in order to increase your market share, leverage volumes driven by claims intelligence about those practitioners and facilities, and ultimately give you transparency into where they're sending folks for treatment, the types of treatment that are being used, whether it's your product or a competitor's product, and ultimately what it costs. So these three legs of the stool are leveraged in many ways in order for different med device companies to quickly understand and interpret market share and market size, specifically where to target and how big their sales force should be, product adoption and preference, specifically which influencers they may want to conduct outreach to in order to make sure that their product is engaged by the patient care team as a whole, and ultimately to give you a better understanding of not only what it costs, but how you might be able to help those providers kind of maximize reimbursement for your product. This brings us full circle for our webinar today. We'd like to transition to, at this point, kind of a open Q&A. Joe, we'll pass the ball back to you.
Well, thank you. I appreciated that presentation, and I want to let everyone know that the replay will be available shortly at the link I pushed out to everyone. You can already get the slides there. James had to leave early, but his question was, you mentioned that reimbursement insights can help me how to grow my market. He wants to know, how granular can you get with that data?
So the granularity for remitted claims can actually be taken at a number of different levels. We find that at a code level is often one level of information that most folks will need. We've actually had some conversations on kind of the payer side where they've been focused on understanding more of the larger provider level roll-up, so all of the different remitted claims and what that average rate is based on different types of diagnosis or service or treatment for a provider at kind of a global level. So we can really slice and dice that information at many different levels, from the procedure and diagnosis at a service line down to a subservice line level or set of codes. We find that depending on the industry that folks specifically are focused on, it is valuable sometimes to have that intelligence at multiple levels, sometimes broken out by payer, setting of care, things like that, knowing whether it was an inpatient, outpatient that was performed, whether it was a minor in some cases versus an adult. Being able to see that and have that level of transparency for where that remittance occurred and which entity ultimately drove it has been very, very tactically insightful for folks that are making, contracting or pricing decisions globally. Okay. Rebecca, is there anything you want to
add? No, I think you covered that pretty well. Thank you.
Okay. Our next question comes from Charles. He asks, can I use reimbursement data not only to see info about products that are direct competition to mine, or can I also see alternative treatment methods and products?
Sure. So you would be able to see both direct treatment based on the different products, but you would be able to also see your competitors, understand what their market share is based on the utility of other products for those specific procedures, especially if you are able to bring to bear some transparency in what your current share is for a specific provider and their volumes. I believe there was a second part of your question. Can you repeat it one more time, Joe?
He wants to know if he can also see alternative treatments. So not direct competition, but other ways to approach, I guess, that condition. Charles, if you want to comment, but in the absence of that, does that give you enough?
So my understanding is that we are able to identify where alternate treatments have occurred, as long as we have an idea of what codes are ultimately driving those alternate treatments, which our claims experts have a lot of experience with.
Okay. My buddy Rob in Florida asks, for someone new to using your data, would you recommend a steeped approach, such as starting with the highest volumes? Or would you start with the complete picture approach to utilizing your services?
So many of the organizations that we work with will come with a specific set of procedural codes or diagnosis codes that they'd like that level of transparency and granularity with. And that's typically driven by a market or a sub-market that they're tactically focused on. So if that is the driver behind it, so you're specifically looking, I don't know, as we've mentioned, maybe pacemakers or CPAC machines, we can focus on those very tactically. If you do have a desire to understand, or there's a various group of products that you are bringing to market and you need more of that broad intelligence, that's also something that can easily be provided. For folks that have used our services, we have products that have things like standard service lines or sub-service lines that allow organizations, if they've got a variety of shifting strategic priorities, to be able to pivot from throughout the course of the year without having to request and scope kind of a custom tactical data deliverable. We find clients actually go both ways, and in some cases will purchase both kind of jointly, depending on what their organization's specific needs are.
I have a question. Can a client get a sample? If I were to give you a code, could you run something for me on a kind of a one-time basis? And recognizing that the data changes all the time, how useful will it be, long-term, but would I be able to see the product before I buy?
Yes, as part of our initial scoping exercises, we will often go back and forth with samples. I would be happy to engage for anyone that does have questions or specific codes that you'd like to look at. I'd be happy to put you in contact with some of our solutions consultants. They are definitely the subject matter experts that do a lot of that scoping exercise with clients that are looking to purchase and have the best transparency into what data attributes could be provided, and we do that on a regular basis.
So I would advise everyone on this call and anyone who's watching this replay, there's his email address, folks, richard.grape@lexisnexisrisk.com. Go get a free sample and test this stuff out, and if it makes sense for you, they're ready to help further. We have one last question. It's from Beth, and she asks, I'm curious about alert-based insights that you mentioned. How quickly can that data be disseminated?
So as Rebecca mentioned,
Go
Yeah,
ahead.
so as Rebecca mentioned, for alert-based insights, specifically claims data updates at various levels of frequency, and we're truly the most robust data sources will be aggregating from a multitude of different claims updates and then resolving back which ones might have been a permutation or a change as part of that claims adjudication process. So for an alert-based insight, because access to that information in a short window of time is so critical, companies like LexisNexis will actually leverage a multitude of different data sets in order to provide you as near real-time intelligence as possible. So having access to claims that update on a daily basis are critical. Most of those alert-based products that we run can update and send out notifications, within hours in some cases. I know our solution specifically tied to alerts will send both email and flat file so that you have that notification and to the point of where a patient with a specific diagnosis has occurred, so that you have an opportunity to kind of intercept before treatment's performed.
I was working with a client not long ago who was introducing a telemedicine concept that had just gotten CMS approval for a CPT code, and I was given to understand that it would take at least 6 months before evidence of that code being used would even be available for reporting. Is there a parallel in your universe here where even the most up-to-date data is 6 months old?
So of course, some data, especially that comes from CMS, is typically lagged behind a bit more than others. Some of the different sources that you can aggregate from will have more recent data than that. So pulling a data source in that actually pulls sometimes directly payer source information, sometimes information that's coming from various clearinghouses or switch type entities will give you a more real-time access to where those situations have occurred. CMS, I do know, tends to lag a little bit behind some of those other sources in terms of being able to perform alerts.
I guess the takeaway is whatever it is, we'll have it as fast as is possible to get it to you. Last question comes from Craig, and he asks, when developing an international IP portfolio and trying to decide which countries to invest in, can you recommend the best criteria we should consider beyond the obvious of cost, IP protection, indexes, etc., and what tools to use? So what tools would you recommend to use to select the best countries in which to invest?
So Joe, that's not an area I have a lot of personal experience with. I would, as kind of a market planner as a whole, recommend for anyone that is looking to do that sort of evaluation for market entry to look at a wealth of different factors within a potential investment or client site. Some of those to me would be the robustness of, within the healthcare industry, which I'm assuming it is, the infrastructure for being able to track, identify, locate, and keep relevant data on the providers and patients and facilities that you would interact with. If there are within that geography, claims adjudication processes, you'd want to figure out which data aggregators there specifically are able to source that information, whether there's any policy or other security connotations that need to be factored in.
Rick,
I know for myself,
on his behalf, let me ask, may he follow up with you directly with an email, and perhaps you can forward it on to one of your colleagues to give him that kind of assistance? Would that be possible?
Sure, I'd be happy to do that.
All right, there you go, Craig. Reach richard.grape@lexisnexis.com, as all of you are invited to do, to follow up and get that free sample, so thank you for that. Rick and Rebecca, thank you for this presentation today. And on behalf of our guests and the Medical Devices Group, I'm Joe Hage, and we'll see you online soon. Thanks for tuning in.